Irina Ravenko is feeding her 2-month-old son, David, who has just woken up. Several years ago, having children would have been a huge risk for her. Irina had cancer in her childhood and had to undergo plasma transfusion. The donor's blood turned out to be infected with hepatitis B and C.
I got treatment. It was rather successful, but a virus is different from oncology in that it mutates, it adapts to treatment, it lies dormant and then wakes up again. It woke up, and in a couple of years I had to undergo treatment again, and I needed money again.
The costly treatment didn't yield the expected results. Irina applied for free medication paid for by a government program. She was one of the few in the long list of people to get the therapy and recover.
I was already married, we were ready for pregnancy, and I thought that if the doctors allowed us to have kids, then we'd risk it. But we didn't have to risk anything, because at the last moment I got the opportunity to undergo this treatment. Words cannot describe how happy I was.
Dmytro Sherembey, the head of the All-Ukrainian Patient Organization, also had to get treated for hepatitis. However, he had to pay out of pocket. He didn't have hope that the state would be able to help. He was afraid that he won't survive until his turn came. I had to treat it for an entire year with heavy medication, which was accessible then. The treatment cost $12,000. The price of drugs is one of the main reasons for the high mortality rate of hepatitis B and C in Ukraine. The country's Ministry of Health has promised to change the situation. The manufacturer is an American company which has licensed 4 generic companies, and Ukraine got the access to those copies. Now a course of treatment will cost $90. That's 3 months of treatment for $30 each, instead of the former price of $18,000. Making the drugs cheaper will allow more patients in the governmental support program to get free treatment. By the end of the year, 8,500 people will get therapy. In 2019, it's going to be 50,000. Those who don't want to wait can buy the drugs for their new price at any pharmacy.
There is a waiting list. We have 6,000 patients with co-infections, and they require immediate treatment, and there are chronic patients. Throughout 12 weeks, you have to take 89 pills. I think there won't be any waiting list by the end of the next year.
According to the acting Ukrainian Minister of Health, the diagnostics approach for hepatitis is going to change as well. Family doctors will get test kits for patients from high-risk groups.